morning, everyone. First of all, let me thank DPHS for inviting me for this very excellent conference. Actually, a lot of good speakers and really engaging sessions I can see. I'll try to limit my talk as much as possible. My talk is on health taxes in India. Dr. Sundar Raman, in his first session today, already sort of touched upon these larger issues around taxing tobacco products and alcohol, etc. My job is to basically expand on those. So I'll briefly talk about the health taxes in the country and also talk about the different commodities, for which this health taxation is relevant. And I also discuss about the existing, scope of taxation of these products in the country and how, what are the challenges behind those taxation that are currently in place. Okay. So what is a health tax? A health tax is essentially a fiscal measures implemented globally, to essentially to discourage the consumption of demerit products. Demerit products meaning, products such as tobacco, alcohol, or sugar-sweetened beverages, or food which are high in, high in fat, sugar, and salt. We call them HFSS food. So the idea is that, by way of increasing a tax or imposing an increased tax on these products, you can bring down the consumption of these products, because these products are essentially a demerit products which are not useful for the society and also not useful for the individuals who consume it. So we want to discourage their consumption, make them less affordable for people so that they reduce their consumption. That is the idea behind health tax. It always refers to an excise duty. Usually, most of the time, health taxes are excise duties in nature. The typical indirect taxes that you see in terms of value-added tax, VAT or GST, are typically not considered to be a health tax, but there can be exceptions in India. For example, our GST specifically have a higher GST tier on health taxes on these products. So in that sense, our GST can also be termed as a health tax in some sense. But typically in many countries, we would see that health taxes usually take the form of an excise duty. Okay, so the rationale of health taxes is that the idea is that the health taxes is supposed to bring down the consumption. So there is a difficulty for this to move actually, okay. Addressing market failures is again one of the major reasons why we have health tax, because when you have consumption of products like tobacco and alcohol, it creates a lot of what economists refers to as negative externalities and negative internalities. So what do you mean by negative externalities? Suppose when you consume a product, it creates a lot of cost on others who are not actually part of the consumption, right? For example, in the case of tobacco, it's very easily visible. When you are a smoker, there is a second-hand smoking exposure that other people who are not smokers actually exposed to, right? It's also a reason for many type of cancers and many other diseases, right? So there's a cost involved. But the smoker who consumes or spend for buying a cigarette doesn't really pay for that, right? Similarly, alcoholic, for example, a person who drinks and drives, creates a lot of risk for people on the road while he's driving, right? So these are all externalities that are imposed, cost imposed on the others who are actually not part of the consumption. So it makes sense to impose those costs on the smokers or the people who are actually consuming this product itself. And that is why we can impose a tax on them or pay, let them pay for this cost that they're imposing on others, right? That's the whole idea. And then there is also negative internalities. These are basically, the costs that the person who actually consumes these products are not really aware of, right? So oftentimes, people who smoke are not really aware of the many consequences of smoking, right? Similarly, many times, the marketing practices by companies which are selling cigarettes or selling alcohol is really deceptive in nature, that the consumers really do not have full knowledge of the product that they're consuming, right? So because of which without the full knowledge of the product that they're consuming, they end up consuming more, right? And that can create a lot of problems to the society, because when you consume more of these products, it creates a lot of problems in the form of diseases in the society, and these diseases are often taken care of through the public healthcare system, on which everybody pays, right? A public healthcare system is subsidized and it is paid through the tax money of everybody in the society, right? So indirectly, everybody who is not using these products ends up paying for the consequences of these products, which are generated either through negative externalities or negative internalities. So this is why health taxes comes into picture, that you impose a health tax to make these products less affordable, so that people who consume pays adequately for it to cover for all these additional costs that they are creating, right? So these taxes are by definition discriminatory in nature. The whole purpose is to disincentivize consumption. So it helps to effectively target the consumption of these products through health taxes. Okay. So let me now talk about the burden of unhealthy products in the country. This is just a very broad macro type of a picture. We have globally about 11 million deaths that are attributable or could be prevented by reducing the consumption of tobacco, alcohol, and sugar-sweetened beverages alone. These three products, right? These are and in India, if you look at India alone, 1.6 million annual deaths are attributable to consumption of tobacco, alcohol, and SSBs. These are from the global burden of diseases, and this is much more than the combined or the cumulative deaths from COVID-19 that we in India had. This is happening every year. A yearly 1.6 million deaths, translating to more than 3,500 deaths every single day, right? On account of consumption of these products. 77% of this is coming from tobacco use related diseases. Non-communicable diseases, many of you here are aware, the share of the non-communicable diseases in the total deaths has been increasing rapidly. In fact, over the period from 1990 to 2019, this share of NCDs has gone up from 36% to all the way to 65%. And you know that majority of these non-communicable diseases are this tobacco use and use of alcohol, SSBs are some of the major risk factors behind non-communicable diseases. This is again one of the reasons why these products and their consumption should be discouraged. Now, economic burden of unhealthy products, here what we are doing is essentially translating all these risk of deaths and risk of quality of life lost, etc., into monetary terms. Once you do that, we can see that there are estimates available in India which shows that annual economic costs from tobacco related diseases and the treatment cost of treating tobacco related diseases and the premature deaths from on account of tobacco use, etc., and also from the economic burden associated with second-hand smoking, etc., come to about 1.4% of India's annual GDP in a year. Now, if you remember, Dr. Sundararaman was talking about, the percentage of GDP that the government spending as a percentage of GDP was less than 1.4%. So the economic burden coming from these products alone goes more than the entire government expenditure as a percentage of the GDP in a year. So you can see how big this problem is, right? Now that is just from the tobacco alone. Now if you also look at alcohol, the economic burden from alcohol is estimated to be 2.26% of GDP, even more than that, right? So this is a huge problem when you actually try to put a monetary value into the burden of these disease, or burden of consuming these products is actually many times more than the tax revenue that these products generate. It's many times more than any other benefits that you can think of, even conceive of from consumption of these products, right? Similarly, we don't have a similar estimates on the consumption of SSBs, but overweight and obesity, consumption of sugar-sweetened beverages and HFSs, etc., are some of the major risk factors behind overweight and obesity. And there are estimates that $23 billion in 2017 was estimated as the annual economic impact on account of overweight and obesity in the country. Now here is I'm now going through the consumption of unhealthy products in India just to bring you the overall macro picture. There is huge variation across different states in the country. But at the national level, we have the National Family Health Survey 2019-21, which is the most recent data that is available, which talks about the consumption of these products in India. 39% of the males and 4.1% of females in India consume tobacco in some form, whereas 22.4% of males and 0.75% of females consume alcohol in some form. Similarly here, aerated drinks, 25% and 15%. So you can see there's a huge gender gradient in the consumption of these products. Now, mind you that this is only for the age group 15 to 49, right? So the consumption, again, there is significant variation in the prevalence of this consumption of these products, depending on the age group that you look at, the gender you look at, even the area of the state of the country. There's huge variation from one state to other. Some of the northeastern states have very high prevalence of consuming tobacco, for example. So this prevalence varies quite significantly. Even alcohol, in some states, alcohol consumption is actually totally banned in some states. There are some states where it is banned only for people who reside there, but who come from outside, they can consume. So there's huge variation exists in all this. But ultimately, the prevalence is still now at a very high rate, although there is a definitive trend in declining this prevalence, and I'm going to talk about that right now. So if you look at the consumption of tobacco, you can see that there is a definitive decline in trend of prevalence of tobacco consumption. It has been declining consistently. Now, when it comes to tobacco, it is not only the total prevalence that is declining, but even the number of people who are consuming tobacco has been declining in the country. There is a definitive decline both in the prevalence as well as the number of people consuming tobacco in the country. People say that tobacco is addictive. People, once they start consuming, you don't reduce the consumption, but that's not really true. At the population level, there is a definitive decline. There will be a small section which will continue to consume no matter what the price is or how expensive these products become. But at the population level, we know that people are influenced by increased prices and they reduce the consumption, either because this product has become more expensive, or because the people who consume it have become more informed about the ill effect of these products. So whatever be the reason, there are people who quit. The consumption is declining at the population level. It can be seen for both cigarette smoking, BD smoking, etc. Here is the situation about alcohol. Again, huge variation depending on which product that you're looking at. Alcohol prevalence also has declined among males, but there is a small increase in the percentage of women who is consuming alcohol in the country. We're basically comparing the two National Family Health Surveys in India in a span of close to 10 years or so. So there is a small decline in prevalence in males, but a slight increase in prevalence among females. But despite the decline in prevalence, you would see that the volume of sales of alcoholic beverages have actually recorded a very high growth in the last 10 years. It actually means that people who are actually existing consumers, they're actually consuming more, right? So, in fact, there are studies which actually shows the per capita consumption of alcohol has actually doubled in the last more than 10 years. It has doubled for the existing drinkers. So now coming to sugar-sweetened beverages. I'm sorry, because I prepared my slides on a different, style. It has now created a mess here. I didn't know that this was a screen resolution, so the resolution changed and now completely messed up. Apologies for that. Now here is the consumption of trend in sugar-sweetened beverages, but it's not all sugar-sweetened beverages because we don't really have information on consumption of all sugar-sweetened beverages in the country, but this is only for aerated drinks, for which the information is available in the National Family Health Survey, according to which there is again a small decline in prevalence. But just as in the case of alcohol, you would see that even the per capita consumption of sugar-sweetened beverages is also on the rise, as seen by a definitive increase in the sale volume of the sugar-sweetened beverages in the country. In fact, if you look at the trends from other databases, you would see that the sale of juice are now increasing much more rapidly than the sale of other aerated beverages, because in India, if you look at the GST system, there's a much higher tax rate applied on aerated beverages compared to juices. And also there is a perception that aerated beverages are much more damaging or compared to juices. But many people do not realize that all these juices come with a high volume of sugar in it, which is as damaging as most other SSBs out there. But for whatever reason, there is an increase in the consumption of juice in the country compared to other sugar-sweetened beverages. So this has to, reason being, my assessment is that the taxation system needs to be altered to address these. Now coming to health taxes in India, there is a constitutional framework of taxation in India which demarcate taxation responsibilities between the center and the state governments. Prior to the introduction of GST, the union government has the right to impose excise duties on the consumption of the products in India, except for alcohol, right? Excepting alcohol, for all other commodities and services, the union government has the right to impose excise duties, whereas the state governments are the ones who impose sales tax in the form of value-added tax. That used to be the case, and state government has the right to impose VAT on all products as well as excise duties on alcohol. So when it comes to taxing alcohol, it is entirely within the state government, whereas for other products, excise duty is with the center, and the VAT or the sales duty is the prerogative of the state government. But with the introduction of the GST, this picture changed quite a bit. All these excise duties, VAT rates, everything got subsumed into what is called GST. And as a result, now alcohol is kept out of the GST, so still the state government has complete control on taxing alcoholic products, both its excise duties as well as the value-added tax or any other duties that you want to impose on alcohol consumption. It is entirely within the state government. Whereas both excise duties, VAT, everything merge into a GST for tobacco, SSBs, and all the other commodities out there, and it is the GST Council which actually decides what is to be the rate applied or tax structure on these products. So now I'll give you a brief overview of the taxation structure applied on these products in India at the moment. This is for tobacco products. As you can see, there's huge variation in taxes. There is a standard GST rate of 28% applied on all type of tobacco products. As you can see, there is different, quite complicated structure there. For a product like cigarette, taxation varies depending on the length of the stick of the cigarette and depending on whether or not the cigarette has a filter tip on it or not, right? So all these variations exist. Now, there is a standard GST rate which is applied as 28% on all these tobacco products, including cigarettes, BDs, smokeless tobacco products, everything. But there are other components of this taxation which makes it different. We have something called National Calamity Contingent Duty, which is applied only on tobacco products in the country. And then there is a specific cess, which is under the GST, it is called a compensation cess, which is applied on tobacco products and SSBs and some other luxury products in the country. There is a compensation cess. And then there is also a small excise tax which is applied on these products. Now forget about all these numbers. At the end of the day, when you look at the total taxes applied on these products as a percentage of the retail price, it comes to around 51% of cigarettes, 22% for BDs, and 64% for smokeless tobacco. Meaning, when you pay 100 rupees for a pack of cigarettes, 51 rupees goes in the form of different kinds of taxes out there. That's the simple meaning of it. Now, during the past 6 years since the GST introduction, there hasn't been any revision in any of these components except a small revision in this compensation cess, which in itself constitute a very small portion of the entire taxes, right? Whereas before the GST was introduced, almost every year there used to be a revision in excise duties applied on tobacco products, which the finance minister would apply in the announced during the annual union budget. Many state governments in their budget used to revise the VAT rates applied on these products. This used to be a regular phenomenon. So there used to be a regular increase in taxes either at the union level or at the state level for these products that used to happen before the GST. But from the time GST got introduced, this came under the under the GST Council, and they haven't changed this rate at all for the last 6 years. And because of which, there is now evidence that these products are now becoming increasingly affordable. Right? There are studies which shows that post-GST, products like tobacco and SSBs have become actually much more affordable than pre-GST years. And that's really not good for products like this, which will essentially incentivize their consumption further. Now, this is the taxation on applicable to sugar-sweetened beverages. As you can see, again, there are different type of beverages out there on which the tax rate varies. Now, at the moment for sugar-sweetened beverages, there is no excise duties applied. It is just the GST rate and the compensation cess. There is a 28% GST plus a 12% cess applied on carbonated beverages. But again, and then on juice, you can see there's only a 12% GST and there is no compensation cess. So there's huge difference between the tax applied on juice and carbonated beverage. Now, the problem with this kind of taxation is that application of high tax rate on non-alcoholic beverages such as these under the GST are not based on any kind of public health logic, right? You can have, let's say, for example, carbonated beverages. There are carbonated beverages with and without sugar, but attracting the same rate of tax. There are juice products out there which are having added sugar and which do not have added sugar in it, right? But they both attract the same rate of tax. So this is not connected with the quality, or the quality, I mean to say the health consequences of this product. They have a classification which is not taking into account the sugar content of the product. That needs to change, right? So this used to be the tax excise tax rate that is applied on these products prior to GST. Let me skip that. Taxation on alcohol, again, as I said, alcohol taxation is under each state government. So the tax rate itself varies across different state governments. So because this rates varies from state to state, we do not have any central database out there from where we can actually see which state has higher tax or less tax. But more or less, we know that the tax share of as a percentage of the retail price varies from somewhere around 40% to 80% in many states, right? Now, what this chart is showing you is the share of the excise tax in the states on tax revenue. States on tax revenue. You can see there are some states like Puducherry and Uttarakhand where the alcohol tax revenue constitute more than 20-25% of the states on tax revenue. So there's huge dependence on alcohol tax revenue for those states. Whereas there are also other states like Kerala or Manipur or some northeastern states where alcohol tax revenue is not a significant factor. But again, this is only excise tax. This is not absolute value. These are excise tax revenue as a percentage of the state's total gross tax revenue. So when you say 25% of Puducherry's own tax revenue from the state which is generated is coming from the alcohol excise tax revenue only. Yeah, it need not be. It's just the rate. It's just the percentage. So to make it comparable across. Yeah. Now, this is the chart I was talking about earlier, the affordability of unhealthy products. As you can see, this is a metric which actually estimates the affordability in terms of, you know, what percentage of your GDP, per capita GDP is required for you to purchase a fixed amount of these products, right? For example, here I'm talking about 100 pack of cigarettes or 100 pack of a smokeless tobacco pouch or 10 liters of alcohol or 100 liters of a soft drink. For all those, you can see that the percentage, see for example, cigarettes, it used to take more than 7% of your annual per capita income in the country to purchase 100 pack of cigarettes back in 2013, whereas it now takes less than or close to 5%. So you can now, using a lesser proportion of your income, you can afford the same amount of that product, right? So that is why we are saying these products are actually becoming more affordable over the years, right? And this affordability enters in even more drastic in the case of alcohol and soft drinks, right? Now, one of the main reasons, of course, is that incomes are growing, right? Our per capita incomes are growing. India has seen tremendous growth, both in the absolute GDP and also in per capita GDP, we have seen tremendous growth. But when you have such income growth, the price or the price cost of these products also should increase in commensurate with that. Otherwise, these products become more affordable. So in other words, what we are saying is that your tax increases on these products have not been really catching up to offset the price, or offset the income increase or inflation increase that you're seeing in the general economy, right? So you have to have a taxation system in place which will automatically increase the tax rates on this product to more than compensate for the inflation and income growth in the country. And that is the only way to make this product less and less affordable over the time and discourage its consumption. But that is not really happening, right? Now, when we talk about taxation, you know, some people are apprehensive about the impact of taxation. You know, people say, how you increase taxation, these are addictive products, how are you going to reduce the consumption? This is a general apprehension many people have. But at the population level, I can guarantee that there is studies from many countries, including studies from India, which actually empirically estimates the price responsiveness of these products. And in economics, we use a term called price elasticity or on-price elasticity, which essentially looks at the percentage decline in the consumption of a product on account of a certain given percentage increase in its price, right? Now, this is all at the population level. Right? For tobacco products, we see that this percentage range from minus 0.3 to minus 0.95. So when you say for BDs, it is 0.95. It means when there is a 10% increase in the price of BDs, you would expect a 9.5% decline in its consumption, right? Whereas for cigarettes, same 10% increase in price of cigarette would result in only a 4% decline in consumption. Although the proportionate decline in consumption is lesser, there is still a decline in consumption, right? So price increase is still affecting a consumption reduction, although at a slightly less than proportionate manner. It is still affecting a reduction in consumption. That's important. Now, people who can afford, who are rich, might continue to consume. But the large majority of the people who consume tobacco products are not the rich ones, but are the poor ones, right? They have a price responsiveness which is much higher than the price responsiveness of an average rich person, right? So they are there to reduce the consumption in response to an increase in price. And this is not just the case of tobacco. Even if you look at the products like alcohol and SSBs, you would see there is all these products are price responsive. Alcohol products are a little bit more price elastic compared to tobacco, and SSBs are even more price elastic, but they are all price responsive to the consumption. Consumption is price responsive. So what it means is that you can actually use taxation as a tool to reduce their consumption. Because people respond to price increases, you can definitely use taxation as a tool to reduce their consumption. In fact, organizations like WHO, World Bank, they all advocate for taxing these products, because it has been found from empirical studies from multiple countries around the world that taxation is one of the most cost-effective way of reducing the consumption. Because on the one hand, it can reduce the consumption, and also on the other hand, it also generates revenue for the government, right? Yeah. So this is my probably the second last slide probably. So challenges to reform health taxes in India. There are many kind of barriers to reform health taxes in India. Some of them are GST related barriers, and as I discussed, the tax rates are very stable under the GST. Although, in a typical situation for a normal good, it's good to have a stable tax rate, right? But that is good while it is good for many normal commodities, for demerit products like cigarettes or tobacco products, we don't want a stable tax rate. We want to see the tax rates going up as the times go. But that's not happening. There is an undesired stability of this tax rate under the GST on these products. There's near absence of excise duties. In the beginning of my talk, I said that health taxes usually take the form of excise duties as a special kind of tax to make it actually more you need a special kind of excise duty to distinguish it from other commodities. But GST is a general sales tax applied on all commodities. Although there is a higher GST tier rate that is applied on these products, we don't have a proper excise taxation system at the moment applied on these products ever since the introduction of GST. And then GST again is mostly ad valorem in nature. We talk about 28% GST. An ad valorem tax is basically a tax rate as a percentage of the value, right? Now, it is empirically shown that ad valorem taxation is not an effective way of reducing consumption, right? You have to have specific taxes, meaning tax as per volume, right? Because you tax as a tax of price, a percentage of price. The companies have a tendency to decrease this price and retail price, and then it reduces the tax revenue to the government and also makes the products cheaper. Whereas if you tax on the volume, right, it can have any price, but if you tax on the volume, it directly impacts the consumption, right? So in the interest of reducing consumption, it's important that taxes should be in the form of taxing volume, which is called a specific tax instead of an ad valorem tax. Now again, as a GST Council is the authority which actually makes the taxes on these products, taxation decisions on these products. And the GST Council consists of the Union Finance Minister and also Finance Minister from many state governments. Oftentimes, you have to have a consensus within this GST Council to bring about any change in the tax rates on these products, which is very difficult to come up with. So because of which a lack of consensus can result in tax rates not being often changed on these products. Why this is... This is not responding actually, so I'm not sure why it's happening. I want to go back actually because I'm not done with the. Okay. Yeah, I'm getting it. Thank you. Boy. I guess it doesn't want to go back. Okay. You should have told me long back. Sorry. Would have served me some time. All right. Okay, so I should hold it here. That makes sense. So anyway, those are some of the GST related barriers. And then we have tax policy inconsistencies and administrative challenges. One major administrative challenge, as I discussed, was the complexity of the taxation structure itself. As you saw, there are different kinds of taxes. There's a GST rate, there's an NCCD, there is a compensation cess, there's an excise duty. So there's all kind of taxes which varies based on minute product characteristics, etc. Right? So this creates a lot of complexities, and once you have these kind of complexities, what happens is companies takes advantage of these complexities, and then they can often play around with this kind of a tax structure to avoid paying taxes, right? So this legal avoidance of tax avoidance can be motivated with this kind of complexities, right? There is no automatic inflation adjustments, no standard product packaging. Products like smokeless tobacco, for example, we have in India, smokeless tobacco products have a very high taxes. In fact, the tax burden on smokeless tobacco is even more than the cigarettes, right? But still, the taxation is highly ineffective for smokeless tobacco products because the smokeless tobacco pouches are available in such small packets, sometimes 1 gram sachets or 1.5 gram or a half a gram sachets. The retail price of a sachet of a smokeless pouch that is available at the retail end to purchase is so cheap that even if you were to slap a 200% tax rate on it, it still has a retail price which is much small and much affordable, right? So what is being recommended is that you have to have standardized packaging on these products, and you have to have some minimum pack bulk, right? You need to have, let's say, 100 gram pouch. You cannot sell, let's say, smokeless pouches of less than 100 gram, so that the minimum retail price at which it is available becomes at least as expensive as a pack of a cigarette, right? So that is the idea to discourage consumption, right? Oftentimes, consumption of these products are, the young people who are actually starting to consume tobacco or starting to smoke. If, let's say, loose cigarettes are not available to them, they have to shell a large amount of money from their pocket to purchase a single pack of cigarettes, which can be very expensive. But if they're able to purchase a single stick of cigarette, they will have enough change to buy that, right? So there is actually a law in India which prohibits sale of loose cigarettes, but that law just exists on paper. Almost 90% of the cigarettes sold in the country are in the form of loose cigarettes, single sticks, right? And that needs to change. It needs to change for cigarettes. It also needs to change for smokeless pouches. You have to make smokeless pouches at least of 100 or 150 grams. And once you have a bigger pouch, it also allows you to display health warnings properly, etc. Right? And there are political economy factors which are again challenges, conflicting priorities across various ministries. In fact, government under various ministries have different agendas, right? You have an agricultural ministry or tobacco board which actually promotes the sales of tobacco, right? And then you have a finance ministry which actually wants to raise revenue from it, and you have a health ministry which wants to reduce the consumption. So there's all these conflicting priorities, and there's no coordination between different government departments. And then there is also conflict of interest. Government of India actually owns 30% of ITC, right? So there is a conflict of interest right there. So these sort of challenges are to be addressed first. So at the World Bank, we provide technical consulting to federal and state governments on capacity building and help them with formulating or reforming these health taxes in their country, in each state. Yeah. So as part of it, actually, we wrote a background paper on a diagnostic of the health tax landscape in India, which talks about all of these issues that I was discussing right now in detail. We also released a policy brief around these health taxes in India. So there is enough scope in the bank to associate with state governments and federal governments to help them formulate or reform their health tax policies in their respective jurisdiction, and we can provide technical consulting to them. And some of the areas of priority. This is the last slide. Some of the policy priorities right now under the GST, there is something called a compensation cess, which is set to expire in 2026. And this compensation cess takes up cigarettes and 30% on sugar sweetened beverages. So once this compensation cess expires, it needs to, some other tax should take in its place, something like excise tax or health tax should be replaced. Otherwise, all on a sudden, these products becomes extremely cheap, which will motivate the consumption. And as I already mentioned, there is a suboptimal alcohol tax policy across different states. 46% of the alcohol consumption in India is going unrecorded. So there is no tax generated from that, 46% of the alcohol consumption, right? So this needs to be regulated. There can be systems we should think about systems in place where this alcohol production and distribution entirely brought into a organized, regulated framework. And then, of course, aligning tax rates with nutrition content of the product or sugar content of products, or even for alcohol, you need to align taxes based on the ethanol content of the product instead of taxing, adding a separate rate on beer or wine or etc. You need to really look at the ethanol content in each of these products. So on these different matters, bank is in a position to provide technical consulting to the state and federal governments. So I'll stop with that, and I'll be glad to take any questions. Thank you.
So, thank you, sir. Thank you for the elaborate presentation on a difficult topic, which is difficult to understand. Thank you once again.
Sir, is there any specific reason to keep the alcohol out of GST?
See, the thing is, when the GST was envisaged, the government really wanted to, states are essentially surrendering their right to taxing anything. So they essentially lose their, power to raise taxes randomly as they want, right? So alcohol was
there was opposition from the states?
It was primarily because the opposition from the state, and also to keep the central state fiscal balance. So that states come into the table and, agree on to forming a GST. For the time being, it was told that, okay, you keep the right to taxing alcohol with you. But over the time, it's quite possible that alcohol can still be brought under the ambit of GST. That's quite possible in the long run. Thank you.
Thank you for sharing your expert vision, sir. Now I cordially invite Dr. Gerald Marian Selvam, Additional Director of Public Health, National Health Mission, to felicitate the speaker on behalf of DPH 2023.